for any antibiotic to work inside the body, it needs to stay inside the body for some time. So it needs to stay in the body. That is called as a half-life of the medicine. So it has to be there for 8, 12 hours, and then you give the second dose. And then there is, there is this medicine, that then you have the dose, and then there is a build-up of medicine, and then the antibiotic, the bacteria gets killed. So which is why when we say that एक antibiotic dose से treatment नहीं होता है, it will not get better. It has to be given in a complete dose, like you have to give it over a period of time, 5 days, 7 days, 10 days.
That we normally do.
Yeah, but the dose also makes a difference. So if you're giving us, like what people do is 1 pinch in water. Now how much water? What is the size of your pinch? Okay, how much water is the animal drinking? All those things are also very important now. So doxy works very well for pox, but if it is only pox, if there are 2 or 3 more, like viral झालं असेल त्याला, fungal झालं असेल, then it's not going to work. So which is why then we do what we call as, we do a smear. So we take, and I may have pictures of this. So we take 1 drop of blood, we look at it under the slide, and we will see what infection there is. When there is a viral infection, the WBC count drops, and you can see that on the slide. So you won't see as many anti-inflammatory cells. And when there are less anti-inflammatory cells, when there are less anti-inflammatory cells, we know, or maybe nothing, we know that a viral infection has set in. When the viral infection sets in, then we know that our traditional antibiotics are not going to work. Then what is our next step is we do a swab. We look at it under the microscope again to see, is it gram-positive or gram-negative organisms? And then depending on that, then we decide what antibiotic to use. So it's not straightforward, and birds, they start showing disease only after when they are half gone.
Yes.
So for kidney disease or liver disease, they are prey animals. They are preyed upon. So if they start showing signs of disease, they will not be able to, they will die. Somebody will predate upon them. For example, जर कबूतर असेल, कबूतर is, I'm going to speak in Hindi, Marathi, and so everybody gets it, yeah. So suppose कबूतर असेल आणि त्याच्यामध्ये इन्फेक्शन झालं असेल, जर तो एकीकडे बसून राहिला तर ते होणार नाही आहे. सो ही हॅज टू फाईट, ही हॅज टू गेट अप, खायचं प्यायचं, आणि पण थोड्या वेळाच्या नंतर ते डिझीज कॅचेस अप. इम्युनिटी चांगली असेल तर काही प्रॉब्लेम नाही, पण इम्युनिटी चांगली नसेल तर मग देन डिझीज स्ट्राइक्स अँड देन दे कॅन बी प्रेडेट अपॉन. सो विच इज वाय, दॅट इज वाय बर्ड्स विल नॉट शो साइन्स ऑफ डिझीज. बट इफ यू लुक ॲट रॅप्टर्स, लाईक इफ यू लुक ॲट बर्ड्स ऑफ प्रे, आउल्स, काइट्स वगैरे, ते सगळं इन्स्टंटली थोडासा आजार झाला की ते लगेचच दाखवतात. वाय? बिकॉज दे आर नॉट इन एनी फिअर ऑफ देअर लाईफ. त्यांना भीती नाही आहे की कोणीतरी त्यांना मारेल. खूपदा यू विल सी काइट्स अँड दे विल जस्ट फॉल डाऊन फ्लॅट ऑन द ग्राउंड अँड विथ नो केअर टू देअर लाईव्स. And we're like, oh my God, this kite is so bad. And I'm like, no, you just need some time to give them, first aid, and they will fly off. So that is why, that is a difference between birds of prey and birds which are preyed upon.
And what is the possibility of pox getting to other?
There is a 100% chance. But so if there is a chance there is pox, then the most important thing is sterilizing your environment, sterilizing your cages, sterilizing your, when you walk into, and if you have aviaries, then you have something called as foot baths. So you keep putting, like you put foot baths, either you can have potassium permanganate, or now there is F10. There is this very nice, work on, or F10 nebulizer, that we use as a nebulizer, that can be used as a spray inside cages, and it acts as a bactericidal and virucidal, both. And see, so there are different names to the same thing. For people who cannot get their hands on F10, you can do any quaternary ammonium compound, stuff that is used to clean hospitals also. But because it is mixed in water and it has to be sprayed everywhere, you have to make sure that it dries up completely and bird does not consume it, because if it can kill the virus and bacteria, it can definitely affect y'all as well, your bird's health also. So yeah.
What about vinegar? Like clean
Yes.
with vinegar and water?
So you can do apple cider vinegar or plain vinegar, vinegar with baking soda. But what happens when you add vinegar with baking soda, there are very strong fumes sometimes that are emitted, and our birds have air sacs, and their lung system is devised in such a way that any kind of strong fumes can be a problem. So you can clean it, wash it, dry it, and then bring it indoors.
मी तिथंच स्प्रे करतो आणि तसंच ठेवलं होतं आतापर्यंत मायक्रोमध्ये तसं नाही आहे.
Ideally not. म्हणजे diluted amounts, so every company, their suggestions change, and it is important to read their leaflet because they update their medicines every single year. They have to do it to make it more safe. तर ते बघायलाच पाहिजे तुम्हाला, कारण खूपदा मी what I have seen is maybe 2 years ago, पण the pamphlet is going to change every year.
पण म्युटेशन ते चेंज होतं.
Yeah, they have to work on their product. So now I think we have a sizable number of people. आपण lecture चालू करूया. बोला ना.
आता तुम्ही म्हटलं की फॉर एक्झाम्पल डिसइन्फेक्शनचं जे काय आहे
हो.
तुम्ही मारा आणि पुसून घ्या.
हो.
ठीक आहे. बट आता हे जेव्हा तुमची 50-100 क्वांटिटी जेव्हा केजीसची असेल, जेव्हा ऍक्च्युअल बर्ड त्याच्यात असेल तर तो डिस्टर्ब होईल ना.
पण तुम्ही म्हणून देर आर F10 म्हणून जे आहे ना, F10चं यू कॅन स्प्रे इट ऑन द बर्ड, यू कॅन नेब्युलाइज द बर्ड, तर त्याचे डायल्युशन्स असतात. सो F10 इज कन्सिडर्ड मोस्ट सेफ. विरकॉन इज गुड, बट विरकॉन इज युज्ड फॉर surface cleaning. When you want to do F10, you want to do, like if you're doing F10, then you can do it for the animal also. Like for respiratory disease in birds, fungal infections, we use it as nebulization for the bird. तर तसं केलं तरीही चालतं. So one medicine is not going to be effective for everything. तुम्हाला फ्लोरिंगसाठी वेगळं करायला पाहिजे, प्राण्यासाठी वेगळं करायला पाहिजे, फूड बोलसाठी वेगळं करायला पाहिजे. So yeah.
Products with colloidal silver वगैरे पण यूज करू शकेल.
You can do it. The problem with colloidal silver is that we don't want them to ingest it. There are certain colloidal products that goes into creams and things like that you can use for bandagings, but we always avoid the bird to consume it because we don't know how bad it is going to be. It's mostly, all these medicines are good for dogs and cats. They're adapted from dog and cat medicine. Nobody has actually done work on application, putting anything on the surface of birds' bodies, because birds preen, groom themselves, and if they are going to eat that, some bird may eat only one drop or may not like the taste and will leave it. But some may just be so paranoid and want to clean every bit of that bird. So it all depends on the mentality of the bird also. For some birds it's okay, they don't care with how dirty their feathers are, but for some they're they're finicky and they'll want to clean everything. So today's lecture is basically an introduction.
सगळ्या बर्डचा एअर पाईप लेफ्टला असतो ना त्याच्या.
So I'll tell you. Let me show you the X-ray, and then you will know. There I have some X-rays as well. So I wanted to first of all invite you to the Exotic Sweat. We have been in Bombay for over 18 years now, and I took this leap because I have my doctors sitting behind my colleagues who we want to be able to bring exotic animal medicine to the whole country. It should not be restricted only to one area of the country, and in an effort to do that, we have started a residency program. So the residency program basically includes us learning for 3 years on topics related to avian medicine, and these are topics that we will be taught by our mentors who are based all over the world. So this program is a very robust program. We do have a lot, we work, it's not that, and just because we are learning doesn't mean that we are working on your animals and learning on your animals. We have a special area where we actually have patients, like for example, chicken, poultry, and things like that, that we treat first, that we work on first before, or practice first before we do anything on your patients. So, which is why, even though the kind of species that we see are massive. Like, we don't only see birds, we see rabbits, we see guinea pigs, hamsters, reptiles may also, there are so many. Yeah, we can't do all the procedures in each and every species, but yes, we have a general idea of, we even see monkeys. So we have a general idea as to how to approach the case, and we do our studies basically before we do anything on your patient. But, and I feel that we are still at the infancy. There is a lot we can do more. It's just that, the client also has to understand that till you don't allow us to do anything, your animal is not going to get better and we are not going to benefit. खूपशे लोक आम्हाला काय सांगतात की नाही, आम्ही जर बाहेर असलो असतो तर आम्हाला हे पटकन झालं असतं. But they also are learning. We are seeing almost more than 1,000 species, different species in exotics. So I would also, I know everybody has to come to an understanding that we are also trying to do our best, and you all have to just trust us, and together we can make this much more better than, and increase the standard of medicine. But today we are going to speak about specific diseases that we see in birds. And we also have, for example, like, y'all, can you, तुमच्याकडे कुठचे पक्षी आहेत?
आफ्रिकन ग्रे आहे, ब्लू बर्ड,
Greys, so big birds primarily. Lovebirds, small birds also, small birds. You have a grey, so there, she has a grey. Tumcha greys, okay? You, sir? Cockatiels. So every bird or every species has a different type of infection that is species specific. Like dogs and cats madhe, if you look at dogs, like you will have German Shepherd with ear problems, okay? Dachshunds with spinal issues. Similarly, and those are, and dogs and cats also have, canine distemper, etc., things like that. But birds are a little different because we haven't reached that area where we have a good breeding system. आपल्याकडे ब्रीडिंगचाच प्रॉब्लेम आहे, कारण का आपण कुठून कुठून पक्षी जमा करतो, आणि those birds are hoarding infectious diseases. And those infectious diseases then get transmitted. But each species is different, so they will not get all the diseases that, suppose budgie hai, that will not get the disease of may not get diseases of an African grey. So we'll start with budgies. How often do we see a vomiting budgie? Manje, it is very common, okay? Macrorhabdis ornithogaster is a part yeast, part bacterial. It's not really sure. First they thought it was a large bacteria, now it is actually it's a yeast, it's a fungus that you see, where you see the bird constantly vomiting. आपल्याला असं वाटतं की vomiting means it is, a bacterial infection of the stomach. But it's not that, because these guys, they tend to store this yeast inside their stomach, and there is an area, so a bird, and I'm going to draw on this. I'm sorry, I don't have a board up here, but I like to draw, and I think it's more visual. So, and excuse my drawing, it's not great, but this is the bird's beak. This is the esophagus. You have your crop, okay? Then from that, you have something called as a proventriculus. You have your gizzard, and then you have your intestines, and then, the cloaca. Your infection lies over here. This proventriculus is an area which is like, it secretes a lot of enzymes, and digestive enzymes are what is secreted over here. So whenever you have a vomiting bird, and that bird has sticky vomit, okay, there are two or three ways birds vomit. One is regurgitation, where they just, they're regurgitating for a male or a female. Male is regurgitating for a female. So they'll just bob their heads, get a little bit of food and feed the female. That is one. The second part is where there is a projectile vomit. projectile means water खूप असतं, there is a lot of water and the bird just vomits everything out. And then the third one is where there is sticky vomit and then small quantities come out. That is basically when the food is in the proventriculus. So when the food is still here, the bird can vomit. But the minute it goes over here, it is, it's like a storehouse. Because this gizzard, it has a very thick layer, okay, of choline, and this is where your seeds and things like that, they get mashed completely. And then once it goes from here into the intestine, it has to be eliminated. Generally, infections stay in the stomach, crop, and in the proventriculus. And they don't rarely go down to the gizzard. If there is something in the gizzard, it's generally viral or foreign body. You also see foreign bodies in that gizzard. You'll see a lot of pictures, and that is why, these vomiting budgies, it's not only bacterial medicines that is going to help. When the bird is vomiting, if you give oral medicines, it's going to vomit even more. So what is the solution for this? The solution to this is fluid, reduce the inflammation, which is why we always give saline, reduce the inflammation, and then we probably will give the first dose as an injection and then follow it up with oral. If you're vomiting continuously, what do you get? You get a drip. That is essentially what we want to do in the birds. But we don't have to give it IV. You can give it just under the skin and it will slowly get absorbed. Yeah? So this is the budgie, and what we also do is to diagnose how this is happening, why is it really Macrorhabdis, is it really that infection? Then we do something called as a swab. So we'll open the beak and there is this coena on top, there is something called as a coena. We'll take a swab from there, smear it on the slide, look at it under the microscope to see whether what kind of bacteria we see. Depending on the kind of bacteria, then we decide the antibiotic. If it is bacilli or it is, whatever it is. And then this is how, I don't think we have, but this is how we make smears. This is a blood smear. If we take one drop of blood and then we look at it under the microscope to see this. This is what Macrorhabdis looks like under the microscope. So when we look at this is a huge, but however, this was what bird was this in? It was in a grey. This was probably a grey which was housed with a budgie. The grey's immunity went down and then this is what has happened. So this is cross species, but it is when you house two different species of birds together, you have to understand that there can be movement of infection from one to another. Yeah? And a very simple way to deal with this is apple cider vinegar. Why is apple cider vinegar considered so good while treating is because the GI system is basically alkaline. Now, whenever the alkalinity level goes beyond a particular amount, the infection sets in. What do you do to counteract an alkaline? You add the acid. So which is why apple cider vinegar is an acid. How much to add is also important. असं नाही आहे की तुम्ही 1 ml टाका किंवा 5 ml टाका. No. So what we do is we will, depending on what apple cider vinegar you have, we get a litmus test paper. And in 100 ml of water, आम्ही थोडं थोडं ते टाकतो. Apple cider vinegar. And then we'll put the test paper inside. And if it is between 6.5 to 6.9, only then do we give that water. Or there is another medicine called as acidifier, म्हणजे acid to increase the acid. It's used in poultry. That is also something we can use. Another thing that we see in cockatiels is psittacosis, where one eye is inflamed or enlarged, and there is constantly one discharge from the eye. Chlamydia psittaci is also zoonotic. It can be transmitted from humans or parrots to humans, and where you get a constant cold. So this is also very, very careful because आपल्या इथे खूपशा लोकांना लहान मुलांबरोबर cockatiels असतात, छोटा पक्षी असेल म्हणून. This can be transmitted to that child also, and it will have a persistent cough, not responsive to any antibiotic. So except for doxy again. Doxy seems to be working very well till now, but there is going to be a day when that also will stop working. If people keep using terramycin in the water, doxy is also going to stop working. So what is a definitive diagnostic test for this is PCR. Now what is PCR? PCR is same swabs that we take from the mouth, but we have to send it to the lab. And PCR tests are generally expensive. Okay, but also when you do PCR, it gives you a confirmatory diagnosis. खूपशा वेळेस काय होतं की people ask, the bird is 600 rupees, the test is 2,500 rupees. Why should we do it? The thing is that it is not only you, but it is your whole family that is involved in this. And if you are not going to be able to treat your bird, somebody is going to get affected at some point of time. म्हणून these tests, this PCR is extremely important. We also do, but there are some people who say, नाही, आम्हाला नाही करायचं, आम्हाला risk घ्यायची आहे. That's fine. Then what do? We also do like a stool sample examination, where ह्याच्यामध्ये there are typical lime green colored urates that are seen. The stool color is lime green, and we also do X-rays where we see, like, you know, the spleen will be big or the liver will be big. त्याच्यावरून आम्ही diagnosis थोडंफार करू शकतो. So when people don't want to spend, it's not that we stop treating the animal. We will give them an alternative saying that this is something that we can try, this is something that we can try, before we realize that till if we treat the bird, great. But if we don't, then we need to do more tests. Okay. Another thing with sun conures, you see, what you see is Pacheco's disease. Pacheco is viral. Again, a very, very strongly viral infection which affects everything. These birds will only be carriers of the disease. And then they will give it to everybody in the aviary. So you've got to be, the reason why we're talking about this is also, all these viral infections are supposed, you know, they can move from species to species, and there is an importance of quarantining your bird. Whenever you go to somebody else's house also, you have, why did I not allow people to get birds over here? Because essentially there could have been contamination, like your bird will be carrying something, your bird would be carrying something, and then this is just a beautiful place for infections to meet and be happy and just go to different houses, and we didn't want that. So the Pacheco's disease also is presented where we can see, you know, this is your X-ray. This is the esophagus, okay? This is the trachea, this line thing. Then over here you have the esophagus that goes, and on the left hand side you have the crop. Then the crop goes down, your proventricular area is over here. This is your gizzard, and this is your liver, this is your heart. This is what we see in an X-ray. आता ह्याच्यामध्ये हे liver ना मोठं झालेलं होतं, and these are what we call as the air sacs. Now these air sacs ideally should be black. Why? Air sacs contain air. Why should there be any kind of color over here, right? But this bird had inflamed air sacs. Viral infections, like I said, called cytokine storm, and there is an inflammation across the whole body, which is why it looked like this. And there is a small video also that I have where you can see that bird, to khat peet hota. He was eating very well, but he just could not use one leg. He was limping with one leg. That was the symptom. Eating well and everything, but just limping with one leg. If you look at him, people might think that he's sleeping, you know, just lying down. But greys don't do this. So, yeah, so he was grooming himself and everything, but he just could not walk. And another thing that we see with African greys is fungal infections. Aspergillus, or caused by Aspergillus fumigatus. How many greys do we see which are feather plucked? Many, many birds, yeah? And we think, nahi, he's missing somebody, you know, it's a behavioral problem. But there could be many other issues. So if you look at, this is a postmortem image of this is the air sac. This is a postmortem image of a grey parrot. And this, you can see these little tiny dots. Those are small granulomas. This is what aspergillus looks like, and this is the CT. Now you will probably ask me, do we have X-ray versus no? Okay. So you will ask me, X-ray मध्ये पण दिसेल ना हे, पण हे असं क्लिअरली दिसत नाही. X-ray मध्ये आम्हाला बघा ना कसं दिसतं. Lungs कसे, the lungs are over here. We can't see anything. We can just see a generalized, haziness on the lungs. But when we do CT, look at this side of the lung and look at this. You can make out कि बाबा इतना बड़ा lesion है उसके ऊपर. What CT helps us do is it's going to tell us whether this bird is going to get better or not. It's going to give us help us give you a realistic view of the situation. Because otherwise we'll say नहीं treatment, इससे treatment करो, उससे treatment करो, पर उससे होने वाला है नहीं ना. So then why should we waste your money? But the thing is that yes, CT is expensive, but it gives you a lot. म्हणजे if it is a valuable bird, like for pet parents, I think every bird is valuable. But when it comes to a large aviary, then it depends. You can definitely it depends on what you want to pick and choose. What we also do is we do endoscopy. So with an endoscope, we go into the air sac. So it's a small surgery. We open the air sac, and we actually with a camera, we will see if there are any fungal lesions inside. And that gives you, it's definitely more invasive, but treatment wise it's good, because from the endoscope we can deliver the medicine straight into the air sacs. But provided it is not, everywhere. Now this is, yeah.
And how do you avoid or try to avoid this?
So your house should be well ventilated. You need to ensure every 3 or 4 years that your bird does not have any respiratory disease. You don't have to start doing a CT immediately, but you can at least start with X-rays. So which is why we do full body checkups. So full body checkups means we will sedate the bird, we will do the X-ray, we will do blood, we will do swabs, and we will see if there is an imbalance in the body of your bird. If there is an imbalance, so when we start doing full bodies, when your bird is small, we have a baseline. And then when we keep doing full bodies on them, checkup, we have like a graph that we make, and we can say that, okay, this value was okay at this point of time, now it has increased, or now it has stayed the same. And that way we have a general idea, because your bird is not going to tell you. And when it comes to the clinic, it is so stressed, we are not going to be able to identify it. And a lot of times, even when we are listening to it via the stethoscope, we can't hear, because a bird is screaming, then his heart is beating almost 250 beats per minute. In all that noise, identifying lung sounds are very difficult. And with us, our lungs are freely moving. But for birds, their lungs are stuck to the back. So they are not freely moving. So the amount of noise that you can get and the amount of give or amount of leeway, that is also less in birds. So the reason why I wanted to show you about this is not an infection, but cockatoos are notorious for eating foreign bodies. So they're walking around all over the house, and then they will pick up one foreign body, something, and you can see this long foreign body in this bird. But if you get it to us within 2 or 3 hours, if it is in the sorry, you'll have to tilt your head a little bit. But if it is the idea, okay, let me not take this video. If you just push the tube out in a sedated bird, it comes out. But if once it goes into the proventriculus, then it becomes a problem. So this is a small clip of this bird that this bird came to us which was vomiting continuously, and this tube was there earlier only, आणि मग ती ट्यूब खाली स्लिप झाली. 2-3 दिवस लोक आले नाहीत. Did you see this x-ray? Can you see something abnormal in this x-ray? Take a close look at the crop. There is this tube that you can see inside, and this was presented to us when the tube unfortunately slipped into the proventriculus. It was advised to the owner by the previous veterinarian that wait, the tube may come out or may pass down through the proventriculus into the gizzard, won't be a problem. These plastic tubes are not something that will dissolve on their own, or the bird cannot vomit it out unless it's a very tiny piece. More often than not, nothing happens to them. They stay inside the body as a foreign object. Any foreign object, when it stays in the body for too long, causes adverse effects, for example, vomiting or inappetence. So that is exactly what happened to this cockatoo. The bird unfortunately was presented to us 2 days after the crop tube slipped into the proventriculus. We had to operate on the bird via endoscopy, and we managed to remove the tube. But this was possible without surgery. These surgeries can be avoided if you present the animals or the bird to us earlier than expected. If you present the bird to us within 2 or 3 hours, we can remove the tube with only plain sedation, and surgery is not required. The smaller the tube, the faster it slips into the proventriculus. The larger the tubes, the faster we can get it out. So it is my humble request to you, don't wait on these cases, don't wait for a magic to happen. Bring it to the veterinarian as soon as you can so that we can manually extract the tube with least trauma to your bird. So the reason why I brought this video up was also that when we get birds, we feed them with these plastic tubes. And that is very, very risky. You don't need the tube, because if in the wild, the mother does not have a tube to put inside the mouth. They do only through the beak do they feed the birds, right? Then why are we doing it? We are doing it to save time. Because we have 50 birds, and we are not the bird mother, and we are not invested in all those 50 birds at one point of time. So, which is why people use tubes. But those tubes can also cause something called as, beak deflection. So there, if you don't hold it properly, you will see scissor beak. ते खूप common असतं scissor beak पक्ष्यांमध्ये. And we think it is congenital, but it is not. Most of the times it's because it is fed wrong. Also, some people, they pinch the beak from the top. Now that beak is actually like conified tissue, hair, nails. When they are small and when they are young, it's very soft. So when you pinch on it, you're essentially, you're sort of creating this squeezy thing on the beak, and it's all, how would I say, it's not how it should be, not triangular, it's pinched in the middle, right? And that can cause issues because the beak has a very big sinus. And those sinuses are important for the bird because the air that is circulating over there helps make the beak more light and gives it more support. So, जर आपलं बोट असेल, जर नख पण वाकडं झालं तरी आपल्याला असं वाटतं की अरे हे काय आहे. तर इमॅजिन त्याचं मेन बीक आहे ज्याच्याने तो खाऊ शकतो, तेच जर वाकडं झालं तर त्याला किती त्रास होणार. Feather plucking in cockatoos is also a very common condition in parrots, and it can be because of so many reasons. So when a feather plucking bird comes to me, I'll just show you what I do. So when you have a feather plucking bird, one, we ask them about how much time this bird has been feather plucking for. Okay, if it is just happened, it's acute. Acute means immediately, it has happened within a week, or then it is chronic. Now chronic means it can be anywhere between 1 month to 6 years, 7 years, 8 years. We see birds even like that, 4 साल से plucking कर रहा है. Okay, so then now we want to know कि, and it can be because you haven't found somebody to address the condition, or it's not because you must have started plucking before, the bird must have started plucking, you must have started treating it for something, but nothing really helped, and then you just forgot about it because the bird was okay. So so then if it is acute, we generally look for symptoms like any kind of behavioral issue, or if there is any pain. If there is pain, or then the bird, why is pain top on my differentials of feather plucking? Is when you have pain on your hand, what do? You will apply something, or you will, come. Basa. If there is pain, what you will do is you will keep pressing the hand, or you will massage it, or you will do something about it. What is the bird going to do? The bird does not have hands. Can't tell you my leg is hurting or my hand is hurting. So it's going to do something. What it does best is preening. What it does by preening is that it'll go and keep plucking at that particular area for a very long period of time. And that can be just to comfort it, because it can't use any other force, right? And then once it starts plucking, after some time, obviously that feather is going to get frayed. So the feathers generally should look like, it should be zipped. Okay, these feathers, these barbules, they should be zipped. What happens to the feather? It becomes like this. This is the first sign of feather plucking, because it is not, these sides are not zipped together. Yeah, it doesn't look beautiful. It looks all scraggy and things like that. And then, so this is generally done in, this scraggy feathers is generally chronic. In acute, they will just pluck because it's painful. And why pluck? Because then they, get this sense of relief. When you pluck, there is pain, there is blood circulation that goes over there, and then when there is more blood circulation, there's more warmth, and that is why the bird feels better. So it's that, okay? And then once the acuteness reduces, then it goes on to chronic. So what we would do over here, we would probably give you some painkillers. In some cases, it does get better. Bird will stop plucking. But if it is a bird like an African grey or a cockatoo who has nothing to do in his life except eat and sleep, then what it will do, it will be like, chalo, once the small pin feathers start growing, those pin feathers are also very irritating. Then he will say, come, let's remove this. And then he'll be like, Areva, this is nice, time pass. So then more feathers will come and he will keep removing all of them. And that is when your feather plucking starts. Now you have to see where the feather plucking starts from also. In some cases, it will start from the stomach. What does that mean? Maybe its stomach is hurting, right? It does have those organs over there. It does have a liver. It does have the, your gizzard. It has intestines, intestinal inflammation. When you have gas in your intestines, you're pressing on your stomach, right? So your bird can also be doing that. And then if it is from the stomach, then we probably say, okay, there could be like maybe worms, okay? Then what we will do is, can we give a medicine just like that? As doctors, as a doctor, I cannot give any medicine unless I have scientific evidence that the problem is there. So what I will say is do a stool sample. And stool sample in birds, one stool will not help. So I have to do either a pooled sample or do it over 3 days. Every day you get stool samples for 3 days, you see. Because worms ka egg, kabhi milega, kabhi nahi milega. So that is why we have to do it over 3 days. If we find eggs, then we will deworm. But if it is not, if there is no worms, I will not deworm the animal. Because for worms, I need to know if the bird is losing weight or is eating more and losing weight. If that happens, it can be worms, but it also can be fungal infection. Can you see the dynamics that are going into treating this bird? It's not only this. There we are only looking for intestinal infections and we are looking at fungal infection. And isme fungal bhi nahi dikhega, because at that point of time the fungus has to be budding. If it is budding, only then toxins are released. If they are not budding, matlab fungus is not growing, toxins are not released. You will not see anything. Now once I am saying that, okay, worms ka ho gaya, deworming ka ho gaya, so that is internal or external parasites. Even little bit of, like if there are parasites that are inside the cage, they will come up only in the night and bite the bird's leg. For example, red mites. They may come only, you won't see them during the day, you may see them only at night. Okay, now that. Then the third thing is metabolic disease. This bird has been chronically feather plucking, but it is an indoor bird, okay, with lots of calcium, but no sunlight, no UV. Is the calcium going to get absorbed? No. If it is not going to get absorbed, वो calcium का क्या फायदा है? That is one part of metabolic disease. Another thing is we are giving protein. Yeah.
So regarding that worm, infection. So is it visible by human eyes, or do we need to test it in the lab?
It's better to, na. You may or may not see. If you can see worms falling down, it's a different story.
Because for budgies, it's hard to difficult to see by human eyes.
So that is what I'm saying, that you may not, and birds which are in captivity, which are not exposed to soil, where will the worms come from?
But then there are two types of birds which I know basically. One is internal what we are doing, and then internal and external parasites.
Parasites.
So whatever the internal parasites, so that may come from their food, or any infection sitting on the cages or something.
Correct, but how often will that affect the bird? So for me, if you're looking at a breeding setup, okay, and I've looked at breeding setups. If you have a problem with intermediate host, which is cockroaches, ants, then I would say do deworming 2 times a year. But if you do not have it, then when you are deworming, when you're giving stuff like fenbendazole, albendazole, or whatever, it is depleting the calcium in your bird's bones, in your bird's body. So are you then supplementing? And another thing is, when you are doing it, you must be doing it in the water, correct? How much of the water is that bird drinking?
Depends.
So till we don't know, see, you can deworm, there is no problem in deworming, it's relatively safe. But what I'm saying is, from the traditional dog and cat medicine, where people say deworm the animal every 3 months, you don't need to do that in birds, because they are, they are sort of elevated, they are not on the floor. If your food bowls and water bowls are contaminated with these kind of pests like ants do carry eggs. How does the worm get transmitted? We generally wash our vegetables and everything and give. So these worms are not going to be seen. You only get it through the eggs. Now the eggs can, even if you put your vegetables in apple cider vinegar, that acidic index is enough to neutralize most of the eggs. And one egg, even if it is inside the body, like birds which are flying outside, you think that they don't get worms? They are normally present inside the intestine, but they create a balance. Now, only when the balance is lost do the other intestinal infections come up. They may not die primarily from worms. And slightly diverging from the point is, we do a lot of cetaceans like whales and dolphins and things like that. If you look inside their body, it is full of parasites. But they are alive for such a long time. So there has to be, a certain amount, any gut is not sterile. At this given point of time, if we test everybody's stool sample, 5 out of the people over here will have worms. But we are not dying because of it. The reason why these things are getting affected is because they are overpowering. And that is because of some stress that is there in your aviary. So you have to find that out, and see, keeping birds in aviaries, your management has to be perfect. There is no, if your management is good, if you're washing your vegetables properly, if you are providing them with a nutritious diet, if you're providing them with, a stress-free environment. Stress-free manje ka hai? Stress-free means what causes stress? Heat is also something that will cause stress. Cold, that is also something that will cause stress. But that doesn't mean that you don't expose your birds. What I'm saying is that you think about it, that this is going to happen, and you prevent it. Like for the monsoons, aviary people will cover their whole cage, their cages with plastic or whatever. So similarly, you have to think about it, that how do I reduce the stress in birds? There are many medicines like Ecare C, or there are some syrups that are there to improve the immunity of the birds. So if you do that on a regular basis, then these problems don't come up. The bird has the strength to fight its diseases on its own. The second last thing that I was talking about was systemic diseases. Systemic diseases means what? Anything that will affect a particular system. A particular system means respiratory system or gastrointestinal system or maybe just the liver, okay? Or maybe the kidney. Birds do have kidneys. So if wherever these things are, the birds, and if it is irritating, like when we cough, what happens? There is irritation. There are times when we want to like scratch yourselves. You use your hands to scratch. What will the bird do? Pluck. Similarly, they also pluck around the spine. This is the spine of the bird. The bird, and this is the wing, okay? This is the wing. They will start plucking over the wing. That is a very common sign. And most of the time I've seen it because of metabolic bone disease. So calcium is something, and the other last thing that we talk about is lifestyle diseases, which is stuff like atherosclerosis, hyperlipidemia. Hyperlipidemia means kai? Means more fat in the blood. And why should it be like that? It's because of our diet and lack of exercise. More than diet, there is no exercise. Our birds are in small cages. They don't have the facility to fly, and I know that it's not going to be possible. Everybody is not going to be able to get, large cages and allow them to be able to fly. So then what will you do? You work on their diet. If your छोटा पिंजरा आहे, तर मग तुम्ही डाएटच तेवढं कमी केलं, तर मग हा प्रॉब्लेमच होणार नाही. Correct? So atherosclerosis is also that happens to humans. The arteries, they get clogged with fat. And that is again very commonly seen in greys. So when people come to us with feather plucking, we are also like, we take a step back and we tell them कि 6 महीना तो लगेगा भाई साहब ये करने को, because we need to go through all of that. Yeah, just you want.
Does it affect fertility in greys?
Absolutely, if it affects the reproductive system, it will. Yeah.
Yeah. About the sunlight, we have an indoor bird and we bought a
UV.
bulb, but we're turning it on every day. Is that okay? Is that good?
That's fine, but a UV bulb, when you buy it, you have to know whether that bulb is emitting the amount of UV that is required for absorption. So generally, this only happens like you need something called as a UV meter to know how much UV that light is emitting. And after a certain point of time, after 6 months, the life of that UVB goes. So you have to keep replacing it. Yeah. And yes, you can do that, but there is no replacement for sunlight. And it should not be through the glass. It has to be open. But it does not have to be like light that is falling. It can just be ambient light that is there outside. The bird should be exposed to it. Bird absorbs UV from their eyes. So from the rods and the cones in their eyes, they absorb UV from there. And that is which is why that eye has to be exposed to that sunlight.
So this lamp won't help them absorb the calcium?
It will. But what I'm saying is that if you ask me what is best,
Yeah, of course.
sunlight, natural sunlight is always best. And when you were asking me about reproductive diseases, when a bird goes into nesting, she always starts plucking feathers to line the nest. We will not confuse that with feather plucking. That is normal for a female, and then once she comes out of that nesting behavior phase, feathers will come back, should come back.
What should be duration for sunlight?
At 8 hours.
8 hours.
But you can do a mix between UV and sunlight also. So you can do like 1 or 2 hours of sunlight method, then you can do the rest of the time you can do UV. Just 1 or 2 hours is also enough, or once a week also is enough, how much ever you can give, whatever you can give. Yeah.
So I have a different mutations of birches. So what will you suggest? So it's an indoor aviary or outdoor aviary is the best?
You need an indoor only because you have mutations. It doesn't, it depends on which mutations you have. You're also looking at the crested and those frilly ones, or the color? All? Okay. So I think you can do it. And right now, what is your thing? Is it indoor, outdoor?
It's outdoor only.
And
I'm not that guy, so I just want to keep birds like in their natural habitat.
that's great. Then you should continue to keep them. Only thing is that like your management should be good, and then in budgies there is a problem of inbreeding. So you have to keep making sure that you know what your lineage is. If there is inbreeding, then the problems start happening. And another thing with outdoor aviaries is that if there are birds flying from the top during the during the season when there is stress, those birds can give infection to your bird. So if your management protocol is good and your bird's immunity is good, nothing will happen.
Okay, so about this, coming back to that UV point, okay. So say an example, my birthplace cage is just on this side, okay. And this sunlight, I mean, there is a covered shade, and the sun is there. I mean, the sunlight is there. So is that be okay?
That may not be enough. It depends. I mean, we'll have to. If you have pictures, great. Maybe if we can look at it, then I can tell you. But distance. Maybe what you can do is,
It's not possible to,
it's not coming, then that is not enough. It has to hit the eye.
Direct sunlight has to be exposed.
direct sunlight.
Direct.
थोडा सनलाईट म्हणजे 12 वाजताचं ऊन नाही. हां.
त्याचं म्हणणं फक्त की उजेड आहे त्या रूममध्ये, पण तिथं सनलाईट नाही ते या कोपऱ्यात सनलाईट आहे ते इथं नाही.
नाही ते that may not be enough. Like I don't know, maybe you will just have to keep a, and what they do in situations like this is they will keep a UV meter and see के तिकडे किती UV radiation आहेत, मग ते absorb होतंय का नाही होतंय. But you need a UV meter to measure it, which is available very readily on Amazon. It is available. It's expensive, but it's available, and they do it for reptiles, herbs.
Supplementing vitamin D3 would help in such situations like
It does, but not enough. UV is, you cannot do away with UV.
Madam, one question.
Huh.
Nowadays, every calcium came up with D3.
Huh.
Okay. So I am giving that D3, calcium with D3, and I am also giving sunlight. Bird is almost 9,
Where it's in sun.
in the sunlight. So what will be the impact? Because
Huh.
if suppose I am a newcomer, I don't know how much quantity I need to give, and I am giving that calcinux. Okay, every day I am giving. That means I am providing
Extra.
extra calcium, and my bird is also sitting in sunlight. So
It depends on how much your bird is eating. Birds also have this innate ability to control what they want. They also have the sense to realize what they require, what they don't. So when they are, if you give a choice to the bird, the first thing that he will build up on is energy. So he will eat enough so that he gets his energy, and the second thing is calcium. If you are giving calcium in the water, and that is why some birds eat a lot of sunflower seeds, because they try to get their energy and calcium from the same source. But if you look at any prescription drug, our problem is that we don't read what is written on the bottle. Our problem is that we just give, अरे मिल रहा है उसको ज़्यादा मिलेगा तो अच्छा होगा, पर कैल्शियम कैन कॉज डिपॉजिट्स इन बोन्स, लाइक फॉर एग्जाम्पल in areas wherever there is inflammation. Inflammation means, for example, there is wound, if there is a fracture, what does the doctor do? Will give you calcium. Why does it go and sit over there? Because there is more blood supply to that area, there is more blood, there is more calcium in the blood, and that is why it goes and it heals faster. In some cases, calcium also is thrown away from the body. But if there is an excessive load of calcium, then what will happen? It will go and deposit in the kidney, it will deposit in the ureter, it will deposit on other areas of the body also. So it is definitely, anything in excess is bad.
So we get him small blocks of calcium. I give him like once a week.
Yeah.
Is that too much?
No, that's fine. That's calcium carbonate.
Because he destroys it like the same day. Like there's
Yeah, but you will see a lot that is fallen down.
But he also like.
Yeah, but you do it only once a day, and there are different ways, different calcium supplements. So you have calcium carbonate and calcium gluconate. Gluconate is water-based carbonate is solid. Yeah, it will not dissolve in water. So that is why people say that you should give very little amounts, which you are doing once a week. Birds also need a lot to do with they need to destroy stuff. Why do they eat it? They eat it because they have nothing. He wants to just break everything.
So once a week is enough.
That's fine. And gluburonate also is water soluble. So if the bird is getting enough water, and if this gluburonate is going inside the body, it will get excreted like that. But if the bird is not having enough water, then again you have a problem. So which is why we try to avoid giving any calcium gluburonate to birds which are from Australia, from the Australian continent, because they don't drink that much water. Cockatiels will not drink water, budgies don't drink that much water, cockatoos don't drink water. So that is why the choice of calcium also is important. Yeah.
यस या टॉपिक रिलेटेड मी असं ऐकलं की बर्ड्सला कॅल्शियम चालतं पण कॅल्शियम D3 जी ह्युमन कॉम्बिनेशन आहे चालत नाही, इज इट राईट?
So it depends on what we are using it for. If you look at all the other products like Vetafarm products and things like that, I think they do have D3, but it has to be in measured quantities, not the human quantities, because it's definitely more. They don't need as much. So when you are buying any human supplement, you should look at what is the requirement and only then dose your bird. असं नाही झालं पाहिजे की ते कॅल्शियम सप्लिमेंट लाईक कॅल्शियम आपण शेलकॅल पण 0.5 ml देतोय आणि हे पण 0.5 ml देतोय. देर आर अदर ऑल्सो विथ फॉस्फरस इन इट, सो डज द बर्ड रिअली नीड इट? D3 लागतं ना, ऑफकोर्स. फॉर कन्वर्जन दे डेफिनेटली नीड इट, बट हाऊ मच?
So it has to be the wet product, not the human product.
No. So for some cases where we know that there is sunlight and things like that, we will probably give. So we have different calcium supplements also that are available in the market. And when we suggest calcium, we don't say give it every day. We say give it 2 times a week or give it 3 times a week. If you are giving something every single day, there is going to be an overload of any nutrient inside the body. And then that can cause issues. So D3, yes, it is definitely required, but not too much. How much it all depends on what is the base D3 of the bird and how much is required. Then we will have to go into what is the ionized calcium of the bird, does it need it, and then what product is required.
Too much medical.
It is the problem तिथेच चालू होता ना की ह्युमन मेडिसिनसाठी एक प्रॉडक्ट चालतं, पण आमच्यासाठी ते तसं नाही चालत. बिकॉज सम बर्ड्स विल ईट समथिंग, सम बर्ड्स विल ईट समथिंग एल्स ओनली. आपण सांगितलं त्याला की पपई खा बाबा, तर त्यांनी तो सांगणार नाही, मला नाही खायचंय. कसं देणार त्याला? तोंडात तर आपण चारू शकत नाही. सो म्हणून ते प्रॉब्लेम्स होतात. आणि देर आर मेनी कॅल्शियम सप्लिमेंट्स इन द मार्केट, अँड वॉट वी आर ट्राईंग टू डू इज कम अप विथ समथिंग that is okay. I mean, we are not making a product. We're trying to see which products are good for what species of birds and how much to give, how much dosing to give, because there are so many. I mean, I used to use Mecalvit, and mag te Mecalvit, then it is now being used as everyday supplementation. But ते प्रत्येक पक्षाला चालणार आहे असं नाही. सो दॅट इज वाय वी विल डू दॅट, अँड वन्स वी हॅव दॅट वी विल पुट इट अप ऑन आवर वेबसाईट और whatever on our page, and you will get that information.
Just 2 small questions. कॅल्शियम सप्लिमेंटेची गरज आहे का? वी यूज नॅचरल सोर्स लाईक एग शेल आणि
Cuttlefish bone.
Will that be sufficient, or we should supplement?
It depends on your bird, which one, what birds you're talking about.
Small birds आहेत माझ्याकडे.
You can do cuttlefish, that is not an issue.
पण त्या केसमध्ये कॅल्शियम सप्लिमेंट द्यायची गरज
नाही. जर पक्षी खात असेल तर कॅल्शियम सप्लिमेंट द्यायची नाही गरज.
नेक्स्ट स्मॉल क्वेश्चन. युवी मला माहितीच नव्हतं. मी 3 वर्ष माझ्याकडे कासव होतं तेव्हा मला कळलं होतं त्याला युवी लावायचं, पण मग मला युवी लावावं लागेल.
There is zero sunlight.
नाहीये माझ्याकडे, उजेड आहे, डायरेक्ट सनलाईट नाही.
Again, photographs will help. म्हणजे access to this we'll come to know. Yeah.
आणि लास्ट क्वेश्चन, शॉर्ट क्वेश्चन. आता ब्रीडिंग सीझन चालू आलाय, तर माझे भज्जी अड्डी टाकतात,
फेकतायत बाहेर.
तर म्हणजे मी हे लावलेलं नाहीये बॉक्स वगैरे. कॉकीटेल पण टाकतायत, इव्हन माझा मसकली पण टाकतोय, आय एम जस्ट रिमिंग मी त्यांना ते देत नाही. पण साईड इफेक्ट काय असतो त्यांचं कॅल्शियम इंटेक कमी होणार ना, कारण इट इज अ शेल ऑफ कॅल्शियम.
No.
इफेक्ट काय होतं ते जेव्हा अंडी देतात त्यांच्या बॉडीतनं काय इंटेक कमी होतो?
कॅल्शियमच कमी होतं.
Okay.
सो
What
so what happens?
Compensate करावं.
नाही compensate नाही. You will have to provide liver supplementation. I'll tell you why. Because when there is an egg that is formed, there is a yolk inside, and that yolk is basically fat. Now that fat is created in the body, or it is taken from nutritional sources. And where is it stored? In the liver. So when your bird is continuously laying eggs, there is something called as, you will see those livers become yellow. And those yellow livers are basic, it's not a problem, but it is there inside the body. If the bird continuously is in this kind of lipidosis, and this fat does not get excreted from the body, there can be fatty liver. And then fatty liver ची next stage असते cirrhosis किंवा tumors. So you will also see a lot of tumors in budgies. You will see a lot, like there are lots of tumors, and they are fatty tumors because primarily त्यांचं diet seed diet असतं. So let's do one thing. Let me finish this and then we'll take questions. Just I think the last one that we want to talk about is the macaw, where macaw wasting disease, or PDD. This is a common buzzword that everybody says. Macaw hai to PDD, vomiting hua, अरे उसको PDD शायद है. Macaw babies till the age of 4 always have something called as, can get proventriculitis, because that proventriculus that I spoke about, that is very, very sensitive, and infection can go in and then it will just swell up. Okay, and what you can see over here is, this is a lateral x-ray of the bird, and this bird was just presented to us a couple of days ago. Can you see this bit? This whole thing. This is the proventriculus, this is the gizzard, this small thing. This thing has become, it's so big inside the body. So what happens is that the bird was continuously, do we have a video on this? The bird was continuously vomiting, and it makes this, this baby-like sound, like, he'll flap his wings and continuously make baby-like sound. Does not mean that it has PDD. Again, diagnostics is the way to go for us, and that's why X-ray किया, फिर blood किया, उससे देखा कि infection है कि नहीं. We saw that there was massive amount of infection. We started treating the bird is fine. It takes 3 doses. If your antibiotic is correct, it takes 3 doses for the bird to respond. So which is why we always tell us either the following day or in 3 days, in 3 doses if your bird is getting better. If it is not, then we will taper one antibiotic and start the other, or we will repeat the swab and see why this medicine has not worked. This was bacterial, right? This one was a major bacterial infection. So what had happened was, this bird was, Sujit, do you remember, anybody remembers this case?
Yeah, so this bird on cytology, that is when we test the stool, and I think we'll just come.
Yeah, just come ahead.
So when we tested the stool as well as oral swabs, we just found a lot of bacteria. And there was just one type of bacteria. Usually when we check the oral cavity as well as the stool, we want to see a good mix of bacteria. That means that there's a healthy population inside the gut. But with this macaw, it was just one type of, small bacillus or rod-like bacteria. So there was some sort of overgrowth, and this could have caused the inflammation in the proventriculus. So when we just started giving fluids, anti-inflammatories, painkillers, and also feeding the bird more frequently but smaller quantities, the bird started responding. And we started a very basic generic antibiotic, amoxicillin, and we wanted to wait and see how the bird did. And within 3 days, it had stopped
Vomiting.
and got much better. Yeah.
So there are a lot of success stories also, but this bird was lucky. There are some birds who come to us on day 1, but treatment nahi hot. And most of the times it could be viral, or it could also be that the delivery of the medicine is not happening. When we give medicines to birds, there are times when you are giving the medicine, but the bird is either vomiting it out or throwing it, or the full dose is not going in correctly. And all those things also contribute to healing for the bird. So if there is any problem, like when we advise you any antibiotics, and if you cannot administer, or for this bird they said that the minute we gave the antibiotic the bird vomited. Now what is my answer to this? My answer to this was, the bird did not like the taste of augmentin, so what we did is that give the bird medicine on an empty stomach with a little bit of food so that he cannot vomit it out, and then आधा घंटे के बाद में उसको उसका full meal दे दो. So if there is already food ना in the stomach which is not going down आणि आपण antibiotic त्याला दिलं की काय होणार आहे, उलटी करणार आणि पहिल्यांदा antibiotic निघेल. But what we did was we gave the antibiotic first with a little bit of food, and then afterwards we gave the thing. And it is important to give antibiotic on a full stomach, but if it is not possible, where the bird is vomiting, does not like the taste, give it later. I mean, give the antibiotic first on an empty stomach, no problem. And then there are other, our species are endless, but these are all the other diseases that you can see in commonly seen birds, where you have iron storage disease in toucans, trichomoniasis in pigeons, lorikeets, may you have dietary hyperlipidosis because people give a lot of seeds which they should not be giving. Parakeets get candida, again this is a yeast infection. Ostriches we see vitamin E deficiency. Pheasants we see mycoplasma. Geese we see Newcastle's, this is a viral infection. And Amazons have hypercalcemia related to cancer, which I said that liver disease can cause, increased fat deposits cause that. So in conclusion, the only conclusion to this is your management has to be perfect. And if you know that there is a problem, and if you tell the doctor that we can help you better, what people do is that they don't tell us the whole story. And because there is less information or reserved information, we cannot do our job. No doctor is going to say, "Arey, aise kyun kiya?" We will not do that. But if we don't get the whole story, we are not going to be able to treat. Another thing is importance of quarantining. During quarantining, also testing the animals before they are put into your flock. So keep the quarantine has to be there for 40 days, and quarantine does not have to be in the aviary. It has to be away in another area. Remember that there are zoonotic risks like chlamydia and mycobacterium. TB is also spread from birds. And there is we have a role in prevention and diagnosing disease. If your veterinarian is not able to diagnose the disease, you should not give antibiotics. That is, antibiotics are not an answer to disease prevention or cure. You have to understand why you are giving it. खूपदा काय होतं, even for us, we get antibiotics in a छोटा पिशवी. आणि आपण खातो. Why? Because we trust the doctor. But do you know what is in it? So whenever you are, we unfortunately in this country we are doing this, but I think at least for your birds, it is important, A, to give the correct dose, 2, to give the duration of the dose, and 3, to understand what you are giving is it correct or not correct? And that only can come after diagnostics. So yeah, thank you for this, and I am open to taking questions.
Thank you.
Yeah.